Are you confused with the ipsilateral, contralateral, proximal and distal? So don't be get confused. Assalamu alaikum and welcome back to my channel. So in this video, I'm going to discuss about the anatomical terms which are very important for the medical student. So here you can see a lot of terms like superior, inferior, medial, lateral. So okay, start with the anterior. Anterior means front part, posterior back. Anterior or ventral are the same terms. Posterior and dorsal are the same terms. Don't need to get confused in it. If doctor asks you or tell you about to examine the patient in the dorsal and the ventral view, so no need to get confused what is dorsal view or what is ventral view. It's a simple terminology. Dorsal mean anterior view, dorsal mean posterior view, and the ventral mean anterior view. Simple. Now talk about the superior. Superior mean close to the head and inferior mean close to the foot. Or we can say superior upper part, inferior lower part. Ipsilateral. Ipsilateral on the same side. When we talk about the same side, means right side, right hand, right limb, upper limb, right lower limb. Or contralateral when we talk about the opposite limb, like the right upper limb and the left lower limb. Protraction comes outside and the retraction comes inside. Like when we protect our shoulder joint, shoulders, and retract our shoulders. And another example is TMG. So superficial mean outer surface which we can see, and deep structures. Deep is like what we can't see, na? Cranial close to the head and caudal close to the foot. Cranial means head region and caudal close to the foot region. Proximal upper part, distal lower part. Like for example, metatarsal are proximal to the phalanges and phalanges are distal to the metatarsals. Medial is close to the midline or near the midline, and the lateral is away from the midline. Supine position means lying on the floor and the face facing forward, and prone is lying on the floor and face facing backward. मतलब सुपाइन में जो है वो सीधा लेटना सुपाइन and उल्टा लेटना prone. So here you can see the examples, the direction, the terms superior, inferior, medial, lateral, distal, proximal. So here is another picture in which you can clearly see right, left, medial, lateral, distal, proximal. So anterior or ventral, dorsal or posterior. So this is it.